We shall see. One other thing to know about Dr. Ladapo is that he has not actually yet been confirmed in this post as Florida's Surgeon General. Governor Desantis put him up for the job months ago, and he's been essentially functioning as Florida's Surgeon General for the last several months. But he does ultimately have to be confirmed by the state Senate in Florida. Yesterday, he appeared before the Florida Senate for his confirmation hearing, and it was something.
Thank you so much, Mr. Chair, and thank you, Dr. Ladapo, for being with us today. Do you believe vaccines work?
You're recognized for a series of answers.
Thank you, Senator. I consider vaccines in the same way that I consider other medical therapies. What we care about clinically is whether they are safe and effective, and that is the lens through which I evaluate all medical therapies.
Do you believe that vaccines in fighting against a pandemic like COVID-19 are effective?
You're recognized.
Thank you for your question, Senator. So, again, I would say that the question is a scientific one, and it's one that is answered with data. So the question is informed by data on specific outcomes and specific therapies. So that's the scientific question.
Mr. Chair, just a couple more follow-ups.
Recognized.
Just a yes or no. Do vaccines work in fighting against COVID-19? Yes or no?
You're recognized.
Okay. Senator, I as a scientist, I am compelled to answer the scientific question, and I'd be happy to answer any specific scientific question that you have related to vaccines and COVID-19.
Scientifically, do the vaccines work against preventing COVID-19? Yes or no?
Recognized.
Okay. Well, thank you again, Senator. So, yes or no questions are not that easy to find in science.
That's the Democratic leader of the Florida State Senate, Senator Lauren Book, struggling valiantly to try to get an answer out of Governor Ron DeSantis' hand-picked Surgeon General for the state of Florida. Senator Book and her Democratic colleagues ultimately got up and walked out of that hearing, saying that they were fed up with Dr. Ladapo's refusal to offer any answers to any questions. After that confirmation hearing, the Florida Sun-Sentinel published this response from the paper's editorial board. Quote, Joseph Ladapo and his contrived evasiveness must go. Quote, Dr. Joseph Ladapo is an expert, all right. He's masterful at dodging questions, insulting the intelligence of Floridians, and avoiding straight talk about the need to be vaccinated against COVID-19. I'm married to data, Ladapo told senators. The reality is that he's married to Governor DeSantis' agenda to politicize the pandemic. The doctor does not deserve to be confirmed as Surgeon General, especially now that he has shown that he has so little respect for the people of Florida that he wouldn't give them straight answers through their senators. I mean, there are a lot of debates around the COVID-19 pandemic and our response to it and effective policies and And some of those debates are absolutely worthwhile. It is, after all, a novel coronavirus. And so, therefore, we learn more about it scientifically as we move on in time and we live with it for longer. Some of those debates are absolutely worthwhile, but some of them are ridiculous. And on the question of do the vaccines work, I don't know. Seniors who are vaxxed are 50 times less likely to be hospitalized with COVID than seniors who aren't. 50 times? That's not statistically significant enough for you? I mean, not to be weird, but even Donald Trump says the vaccines work. The vaccines work. But the Surgeon General of Florida cannot bring himself to say that. That is apparently a bridge too far for that state's top doctor. So This week, Governor Desantis unleashed this furious tirade against the Biden administration, blasting President Biden and the administration for stopping shipments of 2 monoclonal antibody treatments for COVID. Governor DeSantis called that a sudden and reckless decision and accused the Biden administration of basically killing people, blocking life-saving treatments. He said he's going to fight back against this decision. What is so strange about this explosion of rage from Florida's governor, Ron DeSantis, is that the reason the federal government stopped sending those 2 particular monoclonal antibody treatments to Florida and all the other states in the country is that those 2 monoclonal antibodies do not work against the Omicron variant. Those 2 monoclonal antibodies have been a fantastic treatment for previous variants of COVID. They have saved lots and lots of lives, but they do not work against Omicron. Omicron is mutated in such a way that it is not susceptible to those treatments. The drug makers themselves say they have done the tests, and those monoclonal antibody treatments don't work against Omicron. And Omicron now makes up 99% of new cases of COVID across the country, including Florida. You do not have to be a chemist to understand this. It is not that hard to understand. If you are 4 years old and listening to me right now, you probably understand what I just said. There is one monoclonal antibody from GlaxoSmithKline that does still work against Omicron. That drug is unfortunately in very short supply right now, and they're struggling to make more of it as fast as they can. But from those other 2 companies, from Regeneron and Eli Lilly, their antibody treatments, while they worked on earlier iterations of the coronavirus, they do not work on the current one. Again, this is easy. This is not even like math. This is like counting on your fingers territory. But in Florida, they apparently cannot get that. Even before today, all this month, Governor Ron DeSantis has been on this kick about how many antibody treatment centers he's opened and how many doses of Regeneron, the one that doesn't work against Omicron, how many doses of Regeneron he has managed to secure for Floridians, and how the Biden administration hasn't been sending enough and he's demanding more. He has been doing this even though it has been clear for weeks now that these treatments don't work against the Omicron variant, and the Omicron variant has taken over. A week ago, the Daily Beast summed it up with this accurate headline: Ron DeSantis opens antibody centers that are useless against Omicron. And Governor DeSantis' Surgeon General, Joseph Ladapo, has chimed in, too, saying we should not just listen to people labeled as experts on these matters. He says he will personally continue using those antibody treatments on patients with Omicron, even though they are proven not to work against Omicron. It is such a weird fight to pick right now in Florida. Under the leadership of Ron DeSantis and Joe Ladapo, Florida is insisting that as a state government, they're going to do nothing to mitigate the spread of COVID whatsoever. And worse than that, they will continue to spread doubt and misinformation about both vaccines and masks. But they also insist they must be allowed to continue to give people monoclonal antibodies that literally do not work against the Omicron variant, which is COVID now. We are 2 years into this pandemic. This is what passes for pandemic policy in our 3rd most populous state. And as I said, Republican politics are in such a state right now that what happens in Florida tends to spread to other red states as soon as it gets featured on Fox News or whatever. Dr. Ladapo's confirmation process to become officially the Surgeon General of Florida, it is still not complete in Florida. He's due before the Ethics Committee in the state legislature there as early as next week. Perhaps at that next round of confirmation hearings, somebody will ask him about his nonsensical claims about monoclonal antibodies. Perhaps somebody will ask him about his claims of treating COVID patients when it appears he had not. Maybe that will pop the bubble here. Don't hold your breath.